Good afternoon. Thank you for the opportunity to present our work. I'm from Advent Health in Tampa. I have no disclosures. The disclosure, I'm supposed to put 7 seconds for disclosure. This is our team in Advent, Dr. Rosemary, Dr. Ross, and with us here, Dr. Sukandi as a moderator. Metabolic syndrome is a combination of conditions which include abdominal obesity, insulin resistance, hyperlipidemia, and hypertension, which lead to increased risk of cardiovascular disease, stroke, and diabetes. Also, metabolic syndrome shares a common pathway with Hep C in inducing cirrhosis and eventually HCC, or hepatocellular carcinoma. And with the eradication of HCV being more efficient, rates of Hep C worldwide are going down, or in the developed world are going down, while metabolic syndrome is due to sedentary lifestyle, and this is even pre-pandemic data, is going up. And metabolic syndrome is eventually is supposed to override HCV as a primary cause of ACC in the upcoming years. Metabolic syndrome is also a surrogate for perioperative morbidity, not just hepatic surgery, but also general abdominal operations. Our aim was to examine the impact of patients with metabolic syndrome undergoing robotic hepatectomy. And we hypothesized that the robotic approach reduces the perioperative morbidity in patients with metabolic syndrome. Following IRB approval between 2016 and 2020, we examined all the patients undergoing robotic hepatectomy at our center. That was over 270 patients. And we compared the patients with metabolic syndrome to patients without metabolic syndrome. Propensity score matching was by age, ASA score, previous abdominal operations, and IWADI score. Definitions of metabolic syndrome were considered as BMI of 28.8 and diabetes and hypertension, all of them concomitant together. IWADI score, I know there's been a lot of talk about IWADI score in the last few days. Just briefly, a Japanese scoring system to quantify the complexity of minimally invasive hepatectomies. We use this to standardize operations. So I know propensity score matching reduces some sort of selection bias. This is also to reduce the complexity bias. We're not doing easy cases robotically. Our results after matching, we had 37 patients in each arm. There was a difference, anticipated difference with BMI, that the patients with the metabolic syndrome had significantly higher BMI, but had less Child-Pugh score. You can see that the IWADI scores, over 2/3 of our operations were graded as advanced or expert. For the perioperative variables, intraoperatively, we did not see any difference. Both intraoperatively and postoperatively, we did not see any difference in operative duration, EBL, conversion rates, intraoperative complications, and also postoperatively complications and morbidity or length of stay. What we can add is that although we did not see any difference, the patients with metabolic syndrome had very low variables as compared to not compared to the patients without metabolic syndrome, but compared to them. So patients with metabolic syndrome were expected to have a much more severe outcome. So we think that metabolic syndrome did not have any significant perioperative outcomes, but we do believe that the robotic approach did mitigate the adverse effect of patients with metabolic syndrome. Thank you.